Hello, dears, and welcome to Al-Hussaini Virtual Lab, Pathology Talks, Tips, and Practical Tips. Today, I'm going to share with you an important tip when examining skin biopsies. So whenever we encounter a skin biopsy, especially if this is a small bunch biopsy, 5 millimeter or smaller, remember that it is recommended not to bisect the specimen. Actually, it's recommended to keep the specimen as is and to embed as is, and then to undergo multiple, up to 20, sometimes 30 deeper levels in order to look for the pathology. So whenever you embed a skin biopsy as is without prior dissection, remember that the pathology or the pathological findings might not be really present in the initial levels, and you have to examine on several levels, multiple levels, before you come into the center of the biopsy where the lesion might be there. So it's quite often that I actually examine 15, 18, or even more sections from the skin in order to look for pathology, especially if the pathology is focal. And this is why I'm going to share with you this very interesting case for which we did 18 levels and then 2 extra levels for special stains, PAS and ZN. So in total, we examined the 20 levels and we came up with the answer. So this is a 9-month-old patient who presented with a skin rash following BCG vaccination. And the differential diagnosis is this BCG-osis or dermatitis of immunodeficiency. And BCG-osis is a term that is used in the literature to describe disseminated granulomatous inflammation following BCG vaccination, and it's a kind of signal for an underlying immune deficiency. So the very initial levels, if you look at the initial levels, there is almost nothing in the dermis or epidermis. But on deeper and deeper levels, by examining it on multiple serial sectioning, a granuloma was identified in the deep dermis. Now, this was negative for PAS and ZN, but yet remember that we're not to start with suspecting fungal infection, but we are suspecting ZN positive bacilli. But bacilli are really very difficult to detect with ZN. What we really need is the presence, in this clinical context, is the presence of a granulomatous inflammation, which could be detected only after examining something like 20 deeper levels. And then when we continued on with the deeper levels, the granuloma disappeared. So the tip for today, the message from today's tip is double-fold. Number one, that there is an entity called BCG-osis related to dissemination of acid-fast bacilli following a vaccination, and it has certain criteria. I have in the caption a beautiful article that summarizes the findings of BCG-osis. And number two, that with the skin biopsies, especially when the skin biopsy is not bisected, you have really to go and examine several serial and deeper levels until sometimes you consume the specimen. It depends, because quite often the focal finding, the very inobvious, indiscernible finding can be only identified after examining several deeper levels, especially if we're looking at something that is very subtle. I hope you find this tip useful in your daily practice. Thank you.